Good morning. Today I want to talk to you about pelvic pain, most notably endometriosis. Pelvic pain is a problem that a lot of women experience, and it can be from a number of different causes. It could be from ovarian cyst, it could be from fibroids, it could be from endometriosis, which we're going to go through in a lot more detail in just a minute. It could be related to muscles and other structures in the pelvis. It could be the bladder. It could be the colon. So it's important to evaluate pelvic pain for trying to find the source, and secondly, to try to get it corrected. Many of these things overlap. You could have irregular cycles and pain from fibroids. You could have irregular cycles and pain from endometriosis. You could have irregular cycles and pain from ovarian cysts. So determining exactly why the pain is occurring is very important in trying to determine how you're going to treat or how you're going to correct the problem. Today I would like to emphasize more of the endometriosis, which is a problem that really plagues so many women. It used to be many years ago, it was known as the career woman's disease. And the main reason was that women were delaying having their children until they were in their late 20s or 30s, early 30s, and then they started having difficulty getting pregnant, and that's when they were discovered that they had endometriosis. It's not that they didn't have symptoms of it all that time, but it was pretty much ignored by the medical community and treated with medication, birth control pills, things like that. But now with today's medicine and the minimally invasive procedures that we have to make those diagnoses, we not only have diagnosed it much earlier. I've seen it as early as 15 and 16 years old in young women, but also now we have good medications to try to treat the endometriosis. The main goal for me is to keep the health of the pelvis as good as possible. We really want to maintain a woman's fertility, and even after she's decided that she's had her family and she doesn't want any more children, it is real important to continue to keep the pelvis as healthy as possible. And this is done by many different avenues, and it's based on an individual basis. There's really no good cookbook method of saying, well, we do this for everybody, because it's so important to individualize the person. Well, what are some of the symptoms someone may have? Well, it may be pain with your menstrual cycle. It may be pain when you're not having your cycle. You may have pain when you're having intimate relationships with your partner. As I said before, sometimes if the ovaries have been damaged, it can cause irregular cycles. But the thing that we worry the most about, especially when women have not had their families yet, is that it damages the pelvis. It can damage the fallopian tubes, which are so important in transporting the fertilized egg down to the uterus. So it increases the chances of ectopic pregnancy and inability to get pregnant. It also can damage the ovaries, which makes it very difficult, even with the great success they're having with in vitro fertilization now, to be able to harvest eggs from damaged ovaries that have a lot of scar tissue around them. So it's so important to diagnose this early and to get on it and treat it early so that it minimizes the effects to a patient. There have been actual studies that have shown without any damage to the pelvis at all, endometriosis can cause infertility. And the extent of all that is a bit more than what we'll try to get into today. But just realize that today it is so important for women who are having bad menstrual cramps, pain with their cycles, pain when they don't have their cycles, pain with intercourse, that they are fully evaluated, and endometriosis has to rank up there along with the other things that we mentioned a little bit earlier. Let's see here. Sarah. Yes, Sarah, endometriosis is a very tough disease, and As long as there's an intact reproductive system, it's kind of a lifelong problem. Yes, we can treat it. Yes, we can get rid of it for a while, but as long as the tubes are patent, the cycles continue on, then recurrence can occur. The most common way for women to get endometriosis is retrograde flow of the menstrual blood out the fallopian tubes instead of all of it coming out the cervix. And then you get these endometrial cells and tissue implanting in the pelvis. They respond to the hormones just like the lining of the uterus does, because that's exactly what it is the lining of the uterus outside the uterus in the pelvis that causes the problems. The body reacts to this like it was not supposed to be there, which is not. And so therefore the body's trying to clear it and get rid of it. Therefore it causes a lot of inflammation. I frequently will explain that to patients, it's almost like having poison ivy in your pelvis, although it's not poison ivy, but it's the same way. It's the body's reaction to that tissue that causes the majority of the damage that occurs. So yes, it's a long time problem. Once women have completed their families, if we can't clear it up at that point, there are other options that are available that we can do to minimize or completely stop the recurrence of the endometriosis. So it is a problem that many, many women have to deal with. And it is a problem that, if not diagnosed and treated early, can cause damage to the pelvis, and it can cause infertility problems. So don't hesitate to ask your family physician. If you're a young woman seeing your pediatrician or your family doctor, hey, send me to a gynecologist or urogynecologist because I'm concerned about whether I may have endometriosis. It is important to diagnose it early. It's important to treat it early, and it's important not to cause any more damage to the pelvis than we can possibly prevent. Other causes of pelvic pain, as I mentioned, are fibroids, ovarian cysts, and of course, whenever you have endometriosis, ovarian cysts, or fibroids, you can certainly start having adhesions, which is scar tissue in the pelvis. This causes certain organs that normally move around not to be able to move as freely, and that causes pain. There's so many different causes of pelvic pain that is very, very important to find out what's causing it and then try to get it treated. So don't hesitate to bring that up. A lot of women have it, and it should be something, instead of, well, it's no worse than usual, make sure you describe that in detail about what kind of pain that you're having so that it can be addressed and it can be treated. I hope this has been informative for you. I hope you've gotten some information out of it. But if there's any further questions or you need further evaluation, please don't hesitate to give us a call at 843-572-7123. It is something I've treated thousands of cases for, and I would like to be able to help as many people as possible. Thank you.